Hey, this is Dr. Tom. The other day we posted a quote which says, listen to your body when it whispers and you'll never have to hear it scream." And I like that quote a lot. In my office, we've talked a lot about function. We want your body to function really well. We want it to function at its optimal level. Because when it's functioning correctly, you're going to feel really good. And there, you're minimizing your chances for bigger problems to occur. There's no guarantees, but you're going to minimize your chances for bigger problems, the crisis type of problems to occur. So when we talk about function in my office, well, let's ask the question: how do you measure how your body's functioning? Commonly, you get your blood pressure checked. It's the most common thing we do, and you can get your blood work done, looking at your cardiovascular levels, your blood glucose levels, all those types of things. Looking for cardiovascular disease, type 2 diabetes, those types of problems, and other types of problems, obviously. Those are the two most common ones that get checked often, but it doesn't end there. Your body just isn't about your blood pressure, about your blood work. There's a lot of different measurements. We look at things like your waist circumference is really important measurement. We look at your body mass index. We look at how much degeneration, the phase or levels of degeneration in your body. We use x-rays to do that. And one of the most common, one of the most telling ones that tell us how your body's functioning, how your body's aging, or the rate that it's aging, is your body fat, or how much muscle mass do you have on your body. And that's a really important number. But the point being is we look at all these different numbers, because then we can paint a picture to how well your body's functioning. What we like to say here is we want to take a look at how your body's functioning. We want to take a look under the hood to see how your body's functioning, and that's important. Those are the whispers, okay? Because when those numbers, your body fat, your muscle mass, your blood pressure, when those numbers start to creep out of that normal range for your age and gender, well, those are the whispers that we want to listen to. We want to see what's going on there, because if left unchecked, when those numbers start to become abnormal, again, for your age and gender, well, left unchecked, left uncorrected, that's what leads to the crisis. That's what leads to the bigger problems, the full-blown sciatica, the heart attack, the type 2 diabetes. Now you have a crisis on your hands that you have to deal with. So again, we want to listen to those whispers, get your body checked, see how it's functioning at all levels, not just your blood pressure, not just your blood work, but take a look at all of it: your muscle mass, your waist circumference, how much degeneration can your body move, how many, your core flexibility, your core strength. These are all great tools, great measurements that we can look at to tell us how your body's functioning, and therefore, when things are not working correctly, when those numbers are off, then you can put a plan together to start correcting that. Again, always the goal: get your body to function at its optimal level and decrease and minimize those chances for the crisis, those big problems to occur. Take care.